I'm old enough to remember the initial days of the internet, when we were thinking about that when all the information is available to us, then all the problems will be solved, right? And don't get me wrong, I love living in this time. I think it's the best time so far, but it seems like there is some good information out there today that wasn't available before, but still people take breathing for granted. And I took it for granted for many years until I read, I saw that you brought a book that we both read by James Nestor, Breathe,
Yeah.
that goes through the evolution and of our, as a species, and how we have actually devolved,
Yes.
right? From the point of view of breathing, as our brains got bigger, the nose had to, stick out, instead of staying inside where it's nice and warm.
Mm-hmm.
So we're not designed as optimal breathers because of how we've devolved, right? But most people don't know that. Yet, we are born knowing how to breathe, and then somewhere along the line as we grow up, maybe when we start going to school, we start sitting more, we start wearing tighter clothes, then we start creating habits. So I wanted to use that and see if you can expand on that, because when I think of sleep breathing disorders, the first thing that comes to mind is snoring, right? And when I think of snoring, the first thing that comes to mind is someone older and maybe overweight. But what I'm learning from you is that we need to start looking back very early on when children are small, and if we do that, we can save them a lot of heartache as they grow up. Would you please?
Yes. Yes. So our typical screening form for sleep apnea is basically going to target a male over 50, overweight, that snores with high blood pressure and stops breathing at night. So that's who gets diagnosed. And there's your sleep study and there's your CPAP. It's just hand in hand. Might as well give them the same two things right at the same time because they're going to be positive. Very, very few people pass a sleep test, I'll tell you that. And also, not many people want to take a sleep study because many people know that. And if they think CPAP is their only option, they would rather not test and not know and then suffer all the consequences. So that's the importance of really helping get this information out. There really are other options there. But going back to snoring overall and screening, and then even the evolutionary process. So if we actually started screening people differently and had different forms, which actually Stephen Landberg has an amazing screening form for children and adults, and it addresses every organ system, and you just check the boxes, and it's not male, female, child, based. You'll quickly see that everyone really should be testing sooner than later. In the way I would like for it to be, in my mind, with what I've seen over the last 14 years, is the first time you take a medication or prescribed a medication, high blood pressure, acid reflux, sinus congestion, why don't we see and test how you're breathing and sleeping at night, because it's probably something going on associated with that. And again, the earlier we treat it, the better. So children, for instance, when we screen and evaluate children, so many come back positive, and they don't show up the same way that a male's going to show up, and females don't present the same way that children or males are going to present. So one big difference is with females, we're likely going to develop a sleep breathing problem when we're either perimenopausal or become menopausal. And one of the big things there is the fact that our hormones are changing, and estrogen especially protects our airway. So when estrogen levels drop, the airway becomes more collapsible. So the actual diagnosis of obstructive sleep apnea for females during or after menopause increases about 2 to 3 times versus pre. And that's a big thing that a lot of people really don't realize. Other symptoms for females are going to be anxiety, depression, insomnia. That doesn't typically happen that often in males. It's going to be migraines, difficulty swallowing, choking on the food that they're eating. These are things that no one would tie into how they're sleeping at night based on this, but this is what we're talking about, the structure of the airway. So in our late 20s to early 30s, we start losing collagen all over our body. And again, hormone levels start changing. But this is also for males as well, too. You're losing collagen, too, not just me.
Oh, I can feel it.
But as the collagen starts to, affect us and the skin starts to sag, so does the tissue in the back of the throat, the soft palate starts, and so it becomes more collapsible. So again, that whole posterior part of our airway here really starts to shrink or become small and obstruct at night while we're sleeping. So those are some things that can tie in, as far overall as the screening early, but getting the right screening forms in place. So first, getting those validated. I know Dr. Lamberg is working very hard on trying to get his validated so that more people will be using a better screening tool. And then the testing will come forward and people would actually get tested earlier and then potentially avoid a lot of medication and heartache and, sleepless nights.
Do you see that we're making headway in informing people? I mean, I feel like we are because 20, 30 years ago, I wouldn't know where to look for someone to have this conversation, right? Are we making good progress?
We're making headway. Technology, yes. Social platforms, we're definitely making headway. Everything is about education and research, obviously. And the research is coming forward. There have been some groundbreaking things that have just happened in the last 12 months, actually, with this whole area of what we're talking about tonight, which we'll elaborate more on. But at the same time, things need to be evaluated from a larger scale, like from a governmental scale. We need to really go to the top because sleep is so important, but yet there's not a big awareness around it. There are awarenesses and around all these other things, happening, like, just the number of people suffering today with mental illnesses and things like that. And we've talked about cigarettes, we've talked about alcohol, we've talked about all these different things that can harm us and everything, and beware and whatnot. But we've never really had any big campaigns around the importance of sleep, especially linked with productivity. And so one interesting thing, and Matt Walker talks about this actually a lot, is that we're in an environment now, especially with the advances in technology and everything advancing much quicker than we are as humans, obviously, that we're a consumption and based society, and there's no time for sleep. It's productivity. It's go go go. Buy and consume. I mean, and we'll sleep when we die. We hear that type of phrase. He's done a lot of research to show that actually sleep, when you snooze, you lose, is really not the right term, because actually the more you snooze, the less you lose. So there's a lot around that I believe that we could educate large companies on as well too. Google's one. They have nap pods around their campus, and they encourage their team members to go take a 20-minute snooze. And research has shown that their productivity drastically goes up when they're able to take that brief little 15, 20-minute nap during the day. And that just goes to show you, if they're doing that, it's okay to nap. I mean, I love it, but at the same time, if we're sleeping really well, we probably shouldn't need it. So that's an indicator for a lot of people if they're napping every day. But yeah, there's just so much we can do. So I think that this is gradually making its way in the right direction, but it's definitely all about education and really getting through to the right people.
So if we can summarize 3 action points, because I try to, with every one of my broadcasts and every one of my podcasts, is to challenge the community, because if we don't ask for these things, if we don't do better, we're not going to feel better. If we don't feel better, we're not going to live better. But we have to start by doing something, right? So if you can summarize the conversation on 3 things people should have in mind when it comes to sleep breathing disorders, what would they be?
1, we don't present all the same. So know the difference between what a child is going to present with versus a female versus a male. Because, again, they're not the same. So females and children are getting overlooked, and they're not getting tested quickly enough. 2, don't guess, just test. Actually take the test sooner than later, immediately. If you're on any medication, take a sleep test right now. Don't wait until a heart attack or a stroke. And 3, let's try to get this movement going to really take this up to the level that we need to change the guidelines around the care that we have to offer today, because we have innovative technologies that have been cleared now, and so all we need is the education and the information to get into the right hands for the guidelines to change, and then also for our physicians in our community who are so the mainstream of this decision for a lot of people in general, to let them know what's possible and be open-minded to it, and again, just trying to get sleep tests mandated at an early age, just like we do other typical things like mammograms and colonoscopies. Why isn't a sleep test in the loop with all of that stuff? So really getting this to the level of the government and everything that we need to address the root cause of health issues across America. I truly believe that we can revolutionize healthcare worldwide by addressing the root cause of our health issues, starting with sleep breathing.
And that's a beautiful thing. There's a lot of science behind this, and that's what makes it so nice that we live in this time, because it's backed up by so much that's out there. Dr. Griffin, thank you so much for your time. It has been a pleasure. I learned a lot again. Those of you who are online, thank you so much for being here, and those of you who came, thank you so much for being here. Until next time.
Yes, thank you.